With that, we'll move on to individuals testifying on these bills. Jack Hobson DuPont.
Hello?
Hello.
Hello?
We can hear you and see you. Please take it away.
Oh, you can. Okay. I'm 74 years old and the author of the Benzo book, available in hard copy on Amazon and for free online for those who can't afford to buy it. So I was a young guy in the swinging 60s, and I and all of my friends routinely used drugs, illegal drugs like marijuana, as well as pharmaceuticals we'd use off-label, by which I mean it was socially acceptable at a party to go into somebody's parents' bathroom and steal a few Valiums out of their medicine chest. I even got addicted to a hypnotic called Quaaludes for about a year before they were taken off the market. Then a movie came out called I'm Dancing as Fast as I Can about a career woman who got strung out on Valium. It showed in terrifying detail how getting off of that drug could be an unimaginable nightmare. Even in the druggy counterculture, it became common knowledge that Valium was dangerous, infinitely harder to kick than even heroin. So I and my fellow hippies shied away from raiding medicine cabinets, and America's housewives got off of Valium. I grew up, cleaned up, straightened up, got married, had a kid, had a career in computer software. My doctor put me on the antidepressant Effexor, but that caused me to feel agitated. He then prescribed Xanax for the agitation. When he said it was a tranquilizer, I initially declined it, telling him I had been a drug addict in my 20s, and I didn't want to risk taking something like that. He assured me it was, quote, safe and effective, end quote. After I was taking Xanax for about a month, I started to wean myself off it. I took it dutifully right before bed, so I never knew there was a high associated with it, but I just didn't feel right taking a tranquilizer. One day, I idly mentioned to my therapist that I was weaning off the Xanax, and she said almost casually, really, you're doing so well, you should just keep taking it. And so I did. I came that close to avoiding the utter hell I went through years later, trying to get myself safely off that damn drug. Even after getting off it, I never fully recovered. It compromised the rest of my life. Even now, 15 years later, I rarely sleep more than 4 hours a night. If either of these healthcare professionals had told me that Xanax was the same basic drug as Valium, only 20 times more potent, I never would have taken it. Or if they had told me that while it was an incredibly useful drug in the short term, but that with long-term use it could cause rebound anxiety that would be greater than the anxiety I originally presented, I wouldn't have taken it. But they didn't. I wasn't offered the opportunity for informed consent. There was no being informed about it. Thank you very much.
Thank you, sir. Any questions from committee members? Okay, next up we have Bernard Silvernail from the Alliance for Benzodiazepine Best Practices.
Good afternoon. Can you hear me?
Yes, sir.
Okay. Well, thank you for giving me this opportunity to testify in favor of these bills. My name is Bernie Silvernail. I co-founded the Alliance for Benzodiazepine Best Practices along with a 35-year addiction medicine specialist, Dr. Stephen Wright. My wife was injured by benzodiazepines. After 15 years as an RN, Carrie experienced atrial fibrillation. Despite no prior history of anxiety disorder, the AFib was misdiagnosed as anxiety, and she was put on Xanax and Valium, both of which are benzodiazepines. She used these drugs for about 2 months and developed dozens of new symptoms, including depression, dissociation, and pelvic pain. Her doctor said, quote, benzodiazepines don't cause those symptoms. Another doctor helped her recognize that benzodiazepines were indeed the problem. She self-tapered for 3.5 years. She had over 70 symptoms, including severe anxiety and thoughts of suicide. She is now 7 years benzodiazepine free and still suffers every day. For almost 11 years, she has never had a day symptom free. Well, this injury goes by many names, including benzodiazepine protracted withdrawal, benzodiazepine withdrawal syndrome, post-acute withdrawal syndrome, benzodiazepine injury syndrome, benzodiazepine-induced neurological dysfunction. And this is the reason we formed the Alliance for Benzodiazepine Best Practices. Our organization is 3 years old. We have 20 medical professionals plus others on board. We're 100% evidence-based and perform real science. We delivered CME courses to over 2,600 prescribers. We've published the most complete book on benzodiazepines in 7 peer-reviewed papers. And with the FDA, we've been working on a benzodiazepine education project for prescribers. Well, we've also reviewed over 600 papers on this problem. What have we discovered? First, the withdrawal and injury syndromes are pervasive after 4 weeks of use, and they are often more severe than opioid withdrawal. Second, there are no definitive studies of benzodiazepine withdrawal and injury. For example, between 10 and 85% are effective depending on which study you read. Third item is several studies claim that benzodiazepines are safe. Most of these were too short-term to see the actual injury syndrome. And number 4, from working with the FDA, we know that they are aware that most prescribers were not trained about benzodiazepine long-term use problems. Most don't know the injury syndrome, and most do not know how to safely taper benzodiazepine patients. Our conclusion: informed consent is needed to inform these prescribers as well as the patients. We support these bills. Thank you.
Thank you so much for your testimony. Any questions from committee members? Okay, seeing none. Next up, we have Jennifer Niles.
Hi. I'd first like to thank the Chairman Madaro, Sear, and the committee for being here today. My name is Jennifer Niles, and I'm 39 years old. I'm a long-term resident of Massachusetts, and I'm here to speak in support of informed consent. I'm a recipient of a daily taken as prescribed long-term 15-year Klonopin prescription, which I tapered in 2016 and have now been off for a total of 5 years. I'm here today to speak about the worsening of anxiety symptoms when Klonopin or any benzodiazepine is prescribed for anxiety or panic symptoms. Now, panic attacks for me first began when I was 12 years old after a traumatic incident that I reported to the police. I handled it responsibly and efficiently in the moment, memorized a license plate, and called the police so I could protect other people. But a week later, I started having panic attacks, which I came to understand were called anxiety, and I resolved these with the power of my mind, and by 14 had made a full recovery. When I was 17, panic attacks came back into my life when prescribed antidepressant treatment, which then led to treatment with Klonopin. And once on Klonopin daily, every single day, I reached a point where when I took a right turn off the highway when I meant to go left, I actually had to pull into a parking lot and call for help because I couldn't think myself through the situation and was experiencing just levels of fear and confusion that didn't allow me to do something as simple as turn around and go in the other direction. This was labeled as mental illness and treated with a long-term mood stabilizer, a low-dose antipsychotic, Risperdal. So I'm here today to ask that you please support the passing of these very important bills for informed consent so patients have more of an opportunity to be treated for what they're really going through rather than labeled with psychiatric diagnoses and signed up for long-term care. Thank you.
Thank you, Ms. Niles. Do we have any questions from committee members? Okay, next up we have Mary Kinsel.
Hello, can you hear me?
Yes, we can.
I'm trying to turn on my camera here. Wait a second. Well, I'll start. I have a very personal interest in this bill because of the injury and disability that my daughter Karen has suffered over the course of a 9-year recovery from doctor-prescribed Klonopin. The effects of this drug impaired her ability to function in every aspect of her life. She's not been able to work and has had to rely on disability assistance. I've testified in the past because of my daughter could not, Today, I'm so pleased that she's also on the list to provide testimony. Karen was prescribed Klonopin for the panic attacks she experienced after her father's death. She was 37 at the time, a fully functioning, competent adult who had earned a master's degree and held a number of responsible positions. She had 2 young children, aged 3 and 6. She was given no warning about the hazards of Klonopin use, nor did she have any way of knowing that the drug manufacturer recommends it primarily for short-term use. Within months, she began experiencing a bewildering variety of physical symptoms. Her health declined in many ways, including the emergence of joint and muscle pain, gastrointestinal problems, increased anxiety and depression, and sleep disturbance. Through her online research, she discovered that thousands of others were suffering with similar symptoms that seemed to be directly related to their use of benzos. After taking this drug for 5 years, she decided to begin withdrawing from it in 2012. Although this withdrawal was done under medical supervision, the physician involved did not follow accepted guidelines for safe withdrawal. A rapid taper was conducted over 3 months, resulting in severe and long-term withdrawal symptoms. The anxiety, terror states, and losses in cognitive function Karen suffered when the drug was out of her system were worse than when she was on it. She was left with nervous system damage and extreme hypersensitivity to every stimulus in her environment, making day-to-day tasks either impossible or dauntingly stressful. It's been truly heartbreaking for all involved. Her children are now 17 and 20, but for almost 14 years of their childhood, they had to cope with having a mom who was extremely limited in what she could do and where she could go. As a single parent, Karen had to have either family members or other caregivers live with her in order to keep the house running. She had to miss most family events and school activities. Only recently have her symptoms largely abated and her functioning improved. This gradual recovery is uneven, however, and subject to setbacks in times of stress. If this bill becomes law, patients will be better informed and fewer families will suffer the trauma ours has experienced. Thank you.
Thank you for your testimony. Do we have any questions from committee members for Ms. Kinsel? Okay, next up we have Beth Harris.
Hi there. Just checking the sound real quick.
You're good to go.
Great. Good afternoon. My name is Karin Gerbert, and today I'm advocating and reading testimony for Beth Harris. Their testimony is as follows. Thank you to the representatives for letting me speak today. I am a certified peer specialist with 13 years experience, and I'm a survivor of benzodiazepines. I have been following medical professionals in my long-term benzodiazepine prescriptions for decades. I had no clue how disabling the benzodiazepines and non-benzodiazepine hypnotics were for people using them as prescribed or discontinuing them. I've taken all the risks, initiative, planning, research, and responsibility for reducing my Klonopin. I have yet to meet any doctor that knows any best practices or even evidence-based practices to help myself or other patients taper. I live in fear my doctors will change or restrict my access to lower doses of my benzodiazepine and try to force me to increase my dose. As a result of withdrawing, I have new mental and emotional challenges: tremors, blurred vision, headaches, tinnitus, migraines, first of my life, exhaustion, pervasive insomnia, extreme restlessness, sensory disabilities, and increased PTSD. It is impossible to work. I am reluctant to go outside my home because it is overwhelming to my central nervous system and involves days of recovery. I have one international online peer support meeting run by the Wildflower Alliance. This has been a lifeline for myself and many in our community. Prescribed benzodiazepine harm exists, even if some professionals blame patients and attribute tolerance withdrawal challenges to mental illness, which I would describe as ignorance and possible malpractice. I was uninformed when I followed my medical professionals into this dangerous and potentially deadly quagmire. I feel fortunate that systemic benzodiazepine medical harm did not kill me. I have long-term concerns about potential dementia. I am a white patient who has had many privileges, and it has still been horrific. It is long past due that benzodiazepine and benzodiazepine hypnotic patients should be afforded informed consent. It is the very least that should be done. We also need withdrawal prescription protection as well. We cannot wait any longer. People are dying while more people are being prescribed this complicated drug. Please pass S1260 H2117, the benzo bill, this session. Thank you very much.
Thank you for the testimony. Any questions from committee members? Seeing none, next up we'll have Rebecca Russ.
Hi. Good afternoon, members of the board. My name is Rebecca Russ. I am a nurse, a mother, recent grandmother, and resident of the state of Massachusetts since 1983. I benzodiazepine in the emergency room in October of 2002 for a back spasm that I had suffered after an injury on the job. After seeing a local neurologist, I was kept on the benzodiazepine Valium for about 15 years. I took it as prescribed. I was given 10 milligram tablets, which I could take up to 4 times daily for muscle spasm. I never took that much. Typically, I would take 5 to 10 milligrams at bedtime. During that time, I slowly began to suffer what seemed like unrelated symptoms. Those symptoms chiefly being hypothyroidism, vision changes, and loss of vision. A slowly worsening generalized anxiety order, of which I had never had anxiety, insomnia, symptoms of air hunger not made better with the use of an inhaler, dizzy spells, random heart palpitations, and all with no physical explanation. After successful spine injection treatment, I stopped taking the Valium. I was no longer in pain. Suddenly, my unrelated symptoms became much worse. The generalized anxiety order turned into panic attacks. The insomnia was crippling. My thyroid became uncontrolled. The air hunger, like somebody was sitting on my chest. The palpitations just multiple times daily. All still with no physical explanation. And I began to develop agoraphobia. I never had issues with anxiety before taking benzodiazepines. Unknown to myself and doctors at the time, these were all symptoms of interdose withdrawal and benzodiazepine injury. My general practitioner at that time gave me Ativan for the insomnia because I was going days at a time without sleeping. The dose was 0.5 milligrams at bedtime. I took it exactly as prescribed. For the first couple of weeks, it worked well. Then those unrelated symptoms started insidiously creeping back in, along with new, more terrifying ones. The right side of my face would go numb. Constant, intense head pressure like the world's worst sinus infection. A perpetual numbness in my toes and up the side of my leg. Episodes of sudden onset extreme tachycardia and high blood pressure, for which I was given metoprolol and lisinopril, more pills. All still with no physical explanation, and panic attacks. These might have been the most troubling. Out of nowhere, with no warning, I would suddenly be gripped with indescribable terror of impending doom and would literally be unable to function. If I were driving, I would have to pull over till it passed. If I were in a store, I would have to run and hide, go sit in my car. Social situations became impossible. I began to miss more and more work, chewing up my sick days. No one could figure out what was wrong with me, and my life began to fall apart. I started to think maybe it was all somehow related to benzodiazepines after stumbling across the website Benzo Buddies, researching symptoms, and called my doctor. She cut off my prescription immediately, and that is when the mouth of hell opened up and swallowed me. Some of the worst symptoms I suffered were crippling insomnia, akathisia, tremors, aphasia mutinous, terrifying hallucinations, dangerous tachycardia, and hypertensive crisis, crushing depression, and suicidal ideation, extreme depersonalization and derealization, a constant state of terror like panic, head tension and pressure so bad it felt as if my skull was trying to rip itself apart. I was unable to work or even leave the house. I was completely dependent on friends and family for my needs. Sometimes I couldn't even walk to the bathroom without help because the dizziness was so bad. I found a new doctor who reinstated me on my original dose of 10 milligrams of Valium at bedtime and slowly tapered me off per Ashton manual guidelines recommended to me on Benzo Buddies over the course of 9 months. I credit her and those I found on the internet on that Benzo Buddies site with saving my life. After a year and a half away, I was finally able to return to work. And now here I am 3.5 years out, and my symptoms have for the most part disappeared, but for a few lingerers. My vision has never recovered. I will still get small panic attacks here and there, episodes of air hunger with transient moments of head pressure and tension. I don't get frightened anymore when I feel them. I know what they are. And
time has expired, Miss Russ. If you wouldn't mind just wrapping up. You can also feel free to send us, any further testimony you have, you could send to us in written form, and we'll be sure to take it into consideration. Okay?
Okay. If you have any questions, please feel free to ask me.
Yes. Do we have any questions from committee members? Okay. Hearing none. Next up, we'll have Margaret Cook.
Hello.
Hi.
Can you hear me okay?
Yes.
Okay. Deep thanks to the committee and representatives for being here today. In 2003, at my yearly physical, my trusted primary care doctor of many years prescribed Xanax to me for work stress. I was initially grateful for the medication and believed that it helped a great deal. 8 years later, in 2011, I was diagnosed with breast cancer. I had a double mastectomy. The 4 days in the hospital following my surgery were excruciating, both physically and emotionally. The pain from surgery was to be expected, but the other serious side effects were not. Everything was too bright, too loud, too hot, too uncomfortable. Once I was home, I remained uneasy, sad, and fearful. I would learn later that these were all symptoms of benzodiazepine withdrawal. 5 years later, in 2016, I was feeling increasingly unwell with excessive menstrual bleeding, chronic anemia, and gastrointestinal problems. A gastroenterologist suggested I stop taking Xanax. After trying and failing to taper at the rate my primary care doctor suggested, I entered a detox center where they gave me phenobarbital to prevent seizures and to monitor for the risk of fatality that can be caused by sudden cessation of benzodiazepines. For the first year after stopping Xanax, I could not sleep, eat, or drink without discomfort. I had severe cognitive impairment, memory loss, no short-term memory at all. I experienced dizziness, nausea, migraines, sensory disturbances, muscle pain, night terrors, involuntary tongue thrusting, frequent urination, depersonalization, anxiety, and more. Some of these symptoms, such as depersonalization, still linger. When my father died in March 2021, it had been 4 years since I had truly felt connected to him after a lifetime of closeness and love. I learned through experiencing this acute withdrawal in 2017 that what I experienced in 2011 following my mastectomy was a slight aversion of the same syndrome due to the interaction between Xanax and an antibiotic I was prescribed at the time. I have not been anemic since I stopped taking Xanax in 2017, and I understand now that the Xanax caused the hormonal and menstrual issues that resulted in a uterine ablation with permanent consequences. Had I known the risk and the potential for negative life-altering outcomes, I never would have chosen to fill that first prescription. We need informed consent to become the law. The potential loss of physical, emotional, and spiritual health as a result of these medications is devastating but preventable. We want others to be informed of the possible side effects and withdrawal risks of benzodiazepine use and cessation. Please help us do the right thing. Thank you.
Thank you. Do we have any questions from committee members? Okay, next up we have John State.
Good afternoon. Can you hear me okay?
Yes, sir.
All right. My name is John State. I'm a patient testifying today from Colorado, where our state legislature recently passed HB 21-1276, which requires prescribers to query the PDMP for benzodiazepine prescriptions and works to establish the following. 1, limits on benzodiazepine prescriptions for certain conditions. 2, board rulemaking to allow for appropriate tapering off benzodiazepines to avoid abrupt discontinuation. And 3, CME requirements regarding best practices for prescribing benzodiazepines. I was first prescribed Xanax in my late teens when I became anxious during the transition from high school to college life. I was diagnosed with an anxiety disorder, and for the next 31 years, I was prescribed a benzodiazepine by the psychiatrist I saw. I always took my medication exactly as prescribed. I was a trusting, compliant patient. I told every doctor I ever saw that I was on Xanax. None ever expressed a concern about it. In 2013, my health began to decline for no apparent reason. I experienced bizarre physical symptoms and crippling cognitive impairment. Over the next 4 years, I saw dozens of doctors and medical specialists about my ever-growing list of symptoms. They had no answers. By 2017, my wife and I were convinced I was dying of a disease not yet diagnosed. That fall, I was referred to the Mayo Clinic, where I underwent a very thorough 2-week-long neurological workup. I was diagnosed with suspected autoimmune encephalitis, for which I was given weeks of IV steroid infusions followed by weeks of IVIG infusions. After showing no improvement, my diagnosis was changed to possibly the genetic form of ALS. I had watched my sister die a horrible death from ALS, and I was terrified. I asked my Mayo Clinic doctor the same question I had asked every doctor to that point. Could my symptoms be related to my medication? The answer was always, no, it's not your medication. Then one winter morning in 2018, I woke up and all of my symptoms were unbearably intense. I left the house in a desperate state, and I was acutely suicidal for the first time in my life. My 7-year-old son and 5-year-old daughter almost lost their daddy that day. In the days just prior, my doctor had reduced my Valium dose, which I now know sent me further into acute benzodiazepine withdrawal. My wife and I Googled Valium withdrawal, Xanax, and Xanax withdrawal. We found online peer support sites and the Ashton manual where every single one of my symptoms was listed. We couldn't believe it. I had been to dozens of doctors and the prestigious Mayo Clinic, and they could not recognize the withdrawal symptoms associated with one of the most commonly prescribed classes of medication, benzodiazepines, which have been in use for more than 60 years. I now know that the benzodiazepine tolerance my prescriptions actually caused the chronic anxiety and depression I suffered from for decades. I'm still tapering off my benzodiazepine, and it is a torturous multi-year process during which I can no longer work. If doctors cannot or will not become educated on the dangers of this class of medication, then I believe it is the responsibility of the legislature to step in and protect the public. If I had been given written informed consent at any point in my 31-year history of taking benzodiazepines, the cycle of iatrogenic harm could have been stopped. Thank you.
Thank you, Mr. State. Any questions from committee members? Next, we will hear from Attorney Amy Parco.
Thank you. My name is Amy Parco, and I live in Winthrop, Massachusetts with my 2 children. I'm a lifelong Massachusetts resident. I am an attorney, and I represent survivors of domestic violence in restraining orders in family court. I've been free of benzodiazepines for almost 5 years, and this is my story. I was prescribed a low dose of Klonopin, a benzodiazepine, after experiencing insomnia while going through a high conflict divorce in 2009. My doctor warned me that this medicine could be habit forming, and that if I took it more than when I was prescribed, I could become addicted. I always took my medicine exactly as prescribed. The medicine stopped working, so my doctor continued to up my prescription periodically. By 2014, my prescription was for 2 milligrams of Klonopin per day. After 5 years on Klonopin, my divorce was over and my life was in a good place. I was happy, I was healthy. I had sold my business of 12 years and I was about to start my lifelong dream of attending law school. The medication was no longer doing anything and I couldn't feel any effects. So I went to my doctor and I asked her if I could stop taking the medication. My doctor told me that I should taper the medication, so she prescribed me a much lower dose. She wished me luck. That was it. I immediately began experiencing what I now know was benzodiazepine withdrawal syndrome. My symptoms included sleep problems, anxiety, weight loss, shaking, hand tremors, night sweats, and cognitive difficulty. My worst symptoms were fatigue and weakness, as well as intense muscle pains, spasms, and cramping. The most unusual symptom I experienced was something called akinesia, which can be described as sort of an uneasy feeling in your body. For me, this meant constant feeling of pins and needles in my feet, the kind you get when you're sort of sitting on your feet and your foot falls asleep, except it wouldn't go away. It drove me bananas. I spent 3 years tapering off Klonopin. I worked with 4 different primary care doctors and at least 3 psychiatrists. None of them had any advice other than to taper more slowly or just go back on the Klonopin. Most recommended an antidepressant, even though I had never been depressed. I was treated as a drug seeker, a drug user, and a crazy person. One time I was even accused of forging a prescription because my psychiatrist forgot to sign it. And the pharmacist came after me and the doctor did, and nobody believed me. It was painful. I was completely alone until I found an online support group like many others here. The people I met online taught me how to use a pill splitter and break one pill up into many micro doses. I learned how to use a food scale to make sure the doses were exact. One time I tried to add pill powder into a liquid to make my micro doses even smaller to avoid the pain and problems I was having. My kitchen looked like a science lab. These kinds of sites are not run by medical professionals, and they should not be permitted to be giving this kind of care. Just in closing, my life is so much better now. I'm feeling much better. I still work with a therapist to process the trauma of what happened to me. And I just ask you all today to pay attention and to pass this bill. Thank you.
Thank you, Ms. Parko. Any questions from committee members? Okay, next up we have Joan Dillon.
Hi, 1 second.
Take your time.
All right. Hi, I'm Joan Dillon, known as Joanna. I'm a resident of Northampton, Massachusetts, and a doctoral candidate in psychology, on leave, with 4 years of counseling experience. I'm also an admin to Benzo Warrior Community, an internet group of 2,000 people with benzodiazepine stories much like my own. I strongly support informed consent. My benzo story begins with the Xanax I was prescribed 20 years ago for grief and panic after a loss. I experienced many debilitating symptoms during the 2 years I took Xanax as prescribed by my doctor, and withdrawal symptoms during a 2-year taper. During that time, I almost lost my life to a terrifying symptom called akathisia, which made me feel that I had to walk or run faster than my body was capable of moving. I survived a second taper in 2012, after I was prescribed Valium in 2010 for anxiety and depression. Today's story, however, begins in 2018. My mother had just died of brain cancer, which caused grief and panic again. Although he knew my benzo history, my psychiatrist prescribed Klonopin. I knew its dangers. I had learned the hard way. But when I brought up its pros and cons, my doctor reassured me that I was the only patient he was aware of who'd had these issues. He believed it would be safe if I took only a, quote, low dose of up to 1.5 milligrams per day. I wanted to believe this, and I trust that he believes it himself. In hindsight, I think he had seen the adverse effects of benzos, but attributed them to the worsening of pre-existing conditions. By March of 2019, I was stuck in a terror state. I was no longer able to feel happiness, motivation, or even a sense of connection that brought me solace. Not to myself, others, nature, or God. I became unable to work and had to resign from my pre-doctoral internship. My doctor recognized that the problem was likely the Klonopin, and we agreed it was time for me to taper. Over the next 2 years, I experienced over 60 emotional and physical symptoms as I slowly tapered. The worst of these was a milder but unrelenting version of the agitation I had experienced 20 years previously, akathisia. I have heard the symptom described as inhumane or torture. It is not an exaggeration. I didn't know, and my doctor hadn't warned me, that your central nervous system can become sensitized to previous withdrawals. This was my 3rd time tapering. My symptoms were so bad that I couldn't care for myself. The financial and emotional toll was extreme. I've been benzo-free for 6 months now, but that is not the end of my story. I still experience debilitating symptoms every day, including akathisia, and I'm still not well enough to return to my doctoral program. Most days, in fact, it's hard to get dressed or shower. My testimony raises an aspect of informed consent that is sometimes ignored. It's impossible for an uninformed doctor to facilitate informed consent. Informed consent requires informed doctors. If the benzo bill is passed, doctors will have to be better informed. Please prevent future benzo injuries by passing the benzo bill. Thank you for hearing my story.
Apologies, I was muted, but thank you for your testimony. Do we have any questions from committee members? Okay. Next up, we have Cheryl St. John.
Good afternoon. I'm Cheryl. So I wanted to testify regarding my sister. My sister, Shannon Roy, was prescribed Klonopin from her nurse practitioner for roughly 20 years. My sister was successful, beautiful, and loved life. In December of 2017, she started to have flu-like symptoms that would not subside. She was feeling anxious, and she could not drive to work or accomplish life's normal routines. She eventually stopped working and was on disability. She progressively got worse, and she knew the Klonopin was no longer working and causing an adverse reaction. Doctors wanted to prescribe her different benzos or higher doses of Klonopin, but she knew that she could not go back to taking another benzo again. My sister's entire body ached, and she never slept. She had zapping in her head, as she called it, in her brain when she tried to sleep. The nights were pure hell, and the days were not much better. It was heartbreaking watching her go through this, and hard for my family to understand. We did not know about benzo withdrawals, and we were counting on the healthcare system to help her. But doctor after doctor dismissed her and told her that there was no such a thing as having these symptoms for this long from benzo withdrawal. At this point, she was 8 months or so, still living in hell, and those were her words. Her world was turned upside down, her words verbatim. She did not want to go to a psychiatric hospital because she was never mentally ill. She just had anxiety when sleeping like millions of people do. She was losing all hope and agreed to go to an appointment at McLean Hospital. My mom took her. After a full day of evaluation, McLean told my sister that she did not belong there, that she does not need a psychiatric hospital, but needed medical help. The medical doctors told her it was all in her head. The healthcare system failed her. She went home, and I promised her we would keep fighting this and find the right doctor who would help her. She hugged me and said she wanted to be alone and tried to sleep. I respected that and told her I loved her and I'd see her the next day. Later that night, August 11th, 2018, she ended her life. I will feel the guilt for the rest of my life for not being able to save her. Benzo withdrawal is very real, and prescribers need to understand the effects these drugs have long-term effects on the brain. Thank you so much for listening. Any questions?
Thank you for your testimony. Yes, a question from committee members. Okay.
Thank you.
Next up, Charlene Casucci from the Benzodiazepine Coalition. Is Ms. Casucci with us? Okay. Next up, Paula Mooney. You're muted, Ms. Mooney.
Oh,
We got you now.
okay. Thank you. Yes, my name is Paula Mooney. When I was in my 20s, I met with a doctor at Mass General Hospital for help dealing with migraines. I left that appointment with prescriptions for 3 milligrams of Klonopin and an antidepressant of 150 milligrams. I'm now in my 60s and a mere shadow of my former self. For over 3 decades, doctors automatically filled these prescriptions, never questioning why the meds were prescribed, how long I had been taking them, nothing. I owned a private school and enjoyed working with young children and their parents for 9 years until my health started spiraling out of control. Anxiety, panic attacks, diagnoses of autoimmune disorders. I developed serious gynecological problems that required numerous medical procedures. Ultimately, I was diagnosed with cancer. I also called off my wedding. I couldn't explain why, because I didn't know myself. I did in time realize the enormity of this mistake, which resulted in my never being able to have children. Eventually, I had to sell my school and my home and move back in with my parents until they passed away. Thankfully, I was blessed with wonderful siblings who have kept me in the family home. Another heartbreaking side effect of this drug is agoraphobia. I didn't understand why I was no longer comfortable going out in public with people whom I knew well. People will call for just so long, and then they give up. I've lost most of my friends. My world was closing in on me. I began developing signs of dementia. I began falling, resulting in several concussions. A very dear, lifelong friend who never gave up on me began checking in on me. She gave me the Ashton manual and then took me to my doctor, who said she suspected that many of my health issues were related to long-term use of Klonopin. She wanted me off the drug and referred me to a specialist for help. I also met with a well-renowned neuropsychologist at Brigham and Women's Hospital, where I learned that I've suffered permanent cognitive impairment. I struggle daily with focusing on simple tasks, formulating my thoughts, simply remembering. How is this allowed to continue for over 40 years? I can't recover the years I've lost. I can't recover the years I've lost, but this bill will prevent what happened to me from happening to others. I thank you for listening. It is my sincere hope that you will give serious consideration to passing this bill. Thank you.
Appreciate your time. Do we have any questions for Ms. Mooney? Okay. Next up, we have Lisa Nash.
Hi, thank you in advance for listening to my story. I was a software startup consultant for 35 years. I have not been able to work in almost 5 years and am now on disability. I would like to share my experience about the consequences of taking a benzodiazepine as prescribed. I was prescribed Xanax for medical procedures that I had done 22 times. I was never, like thousands of others, prescribed Xanax for anxiety, but as a muscle relaxer. I began to have symptoms that my doctor thought were coming from my neck injury, but after he researched more about the side effects of Xanax, he realized all of the symptoms were exactly the same. My list of symptoms is very long, and to save time, I will not speak about them, but will include them in my written testimony. What was the root cause of my severe symptoms? My neck or side effects from Xanax? The only way to find out was to taper off the Xanax. When I asked my primary care doctor, who had prescribed the Xanax to me for years, how do I safely, slowly taper? His response was that he had no idea how. He had never tapered anyone before. He then demanded I do an extremely rapid taper that made me bedridden for months. He would no longer prescribe Xanax to me and left me stranded, risking seizure and death from a cold turkey withdrawal, sending me to the emergency room. Who would help me? I searched and searched until I found Dr. Edward Silberman, the chief of psychiatry at Tufts. When he looked at my CVS Xanax history, he became so upset by the extremely unsafe taper and said that my primary care doctor would have killed me if the taper had continued. He told me to stop the taper immediately. I was 95 pounds and completely bedridden. We weren't sure I would be able to make it to my daughter's wedding. I felt and looked like I was dying. He has me on a slow body-guided taper. His reminder to me is always to remember that this is a marathon, not a sprint. I've been tapering for over 2 years now. 2 years of my life taken from me, with an unknown amount more to go. He figured out that I was allergic to the inert ingredients from the generic form of Xanax called alprazolam that caused symptoms of my extreme facial swelling. He also apologized to me for my unnecessary suffering due to my primary care's lack of knowledge. I have lost everything: my job, my life savings, my house, my ability to do things I used to do, my family, me. My children won't speak to me. They think I'm a drug addict. I've lost all of my old friends. If I had been made aware that after 9 days of taking this drug, that it would take years to get off and destroy my life, I never would have taken it. Let's educate everyone so what has happened to me doesn't happen to you. Let Dr. Silberman be used as the example of how a doctor should treat a patient who is tapering off a benzodiazepine. Let's use our experience to teach other doctors how to taper their patients comfortably. Education is the answer. Would you want this to happen to you? Please pass this bill to prevent future harm. Let's be the leaders John F. Kennedy wanted us to be. If not now, then when? Why let anyone else suffer unnecessarily? Thank you so much for listening, and please, please pass this bill to prevent future harm.
Thank you. Any questions from committee members? Okay, I do just want to pause and just express gratitude for all of those who are sharing such personal stories on this important subject matter. I recognize, as do my fellow committee members, that this is not easy to dive deep into your personal lives and share these stories. And I want you to know that we as members of the legislature are better off for hearing your perspectives, and they will absolutely be included in the deliberations on these pieces of legislation. So thank you so much to all of you. Next, we will hear from Robert Maloney.
Thank you and good afternoon, chairs Madaro and Sear. My name is Robert Maloney and I am a retired police officer. I loved my job. Unfortunately, after 20 plus years of service and numerous injuries, I retired much earlier than I would have liked. For years, pain pills became a daily way of life for me. But I made the decision to stop opioids and I detoxed at home. I endured 3 weeks of absolute hell. But then, with the exception of some residual effects, it was over. I adopted a healthy lifestyle, joined a gym, and ate properly. Things were looking up, with one glaring exception. My ability to sleep, it never came back. I was prescribed Ambien. I had to learn for myself that this type of drug would be even harder to stop than opioids, and that even with a slow taper, I will return to an even more hellish and drawn-out withdrawal than before, and that my natural sleep may never come back. I respectfully ask that you pass this bill and leave a legacy of healing and compassion. Thank you.
Thank you, sir. Any questions from committee members for Mr. Maloney? I do just want to remind committee members that there is a poll in your inbox that is closing at 5 p.m., so in just about 15 minutes. If you have not already replied to the poll, please do so. Next, we will hear from Candice O'Sullivan, Sutherland.
Can you hear me?
Yes.
Oh, okay. Sorry. Thank you. Thank you all for being here, allowing me to testify today. My name is Candice OSullivan Sutherland. I strongly support this bill. Massachusetts resident since 1971, software engineer 35 years, zoning board of appeals vice chair in my town until prescribed drugs left me disabled and dependent on SSDI on March 2016. In the 1990s, my primary care doctor prescribed me Ativan, Ambien daily to deal with stress relating to my mother dying of cancer. I developed dependence, withdrawal symptoms that resulted in the addition of more drug prescriptions. My original symptoms worsened and new ones began to appear. My Ativan doses were increased due to drug tolerance and my symptoms worsened. I was referred to a psychiatrist, but they proved unable to taper me. In 2007, I tapered off the Ativan, losing 95 pounds due to horrific withdrawal symptoms. In 2008, when my husband passed away from being overprescribed opiates and benzodiazepines himself, my Ativan prescription was reinstated to 6 milligrams a day, plus with Ambien. I was alone with no family or wake. I now believe the increase in Ativan caused fibroids resulting in my hysterectomy. My employer of over 20 years, Dell EMC, stopped paying me. I qualified for SSDI disability in 2016. Not my employer, Dell EMC, Dell Technologies, long-term disability plan. Then my employer, Dell Technologies, Dell EMC, kicked me to the curb in 2018. This drug cocktail caused me amnesia, cognitive problems, autoimmune symptoms, neuromuscular disease, chronic pain, and mental health issues that made me unable to work. It all began with symptoms caused by my Ativan, Ambien prescriptions. At a certain point, I realized my problems were the result of polydrugging that all began with my benzodiazepine hypnotics prescription. I contacted a rehab, AdCare in Worcester, but was told my Dell EMC Blue Cross Blue Shield plan would not cover Ativan, Ambien taken as prescribed drug cessation versus alcohol or drug abuse. I believe my doctor tapered me too fast, though he followed standards of care. My health greatly declined. I was sick in bed, unable to drive, alone, and was using adult bladder-controlled diapers for over a year. There were no resources to help me, save for Facebook withdrawal groups, where I found other people in similar situations experience the same horrific mental and physical pain of as-prescribed withdrawal. Since dropping all prescribed pharmaceuticals, I am physically improving. My stage 3 kidney disease completely reversed. I lost 95 pounds the second time, and my Parkinson's, dystonia, protracted drug withdrawal, blah, blah, blah. I am grateful to God I am alive for recognizing it was a prescribed polydrugging, starting with a benzodiazepine. Please pass H1739 SD 2266. It will prevent harm. If we had been given fully informed consent, my deceased husband, Alex Sutherland, and I would never have taken these drugs, which led to his death and my disability and decades of pain and suffering. Thank you.
Thank you, Ms. OSullivan Sutherland. Any questions from committee members? Okay. Next up, Karen Saladakis. Apologies if I mispronounced that.
That's exactly right.
Good guess.
Yep, just silent P. My name is Karen Saladakis. I live in Medford, Mass. I've been a Mass resident all my life. My mother, Mary Kinsel, spoke earlier. So I was taking Klonopin as prescribed by my doctor from June of 2007 after having a panic attack when my father died until February 2012. Over this time, my health declined in many ways, including the emergence of nerve, joint, and muscle pain, gastric problems, increased anxiety and depression, brain fog, confusion, sleep disturbances, exercise intolerance, and other strange symptoms. After much research online, I found thousands of others suffering with similar symptoms, that seemed to be directly related to their use of benzodiazepines. I then began my journey to withdraw from Klonopin, but sadly, psychiatrists, on the whole, do not know how to safely withdraw people from this class of drug. So what should have been at least a 2-year taper ended up being 2 months and was supervised by a holistic detox center in Arizona, which cost my family thousands. I had 2 hospitalizations after returning from the detox center, at which time more psychiatric drugs were added in an attempt to treat, quote-unquote, treat the withdrawal and my supposed, quote-unquote, underlying condition. In the years following this period, I have had to completely alter my life and lifestyle. Prior to this medical crisis, I was a successful professional, writing grants and managing programs for a large community action agency. I have a master's in nonprofit management from the Heller School of Brandeis, and my future was bright and full of promise. When benzos entered my life, all that changed. I could no longer work. I had to apply for disability. And as a single parent with no partner, I had to find live-in assistance so that I could continue to care for my children. In the early days of my healing, I was so cognitively impaired, I could not even figure out how to make a sandwich. I would open the refrigerator and stare at the contents. I knew what I needed, but somehow could not put the pieces together. The most heartbreaking aspect to all of this is how my kids have had to cope with a mom who is extremely limited in what she can do and where she can go. And although I've done my best to support them emotionally and coordinate logistics from the couch, I've had to miss most of the outings, school performances, and the like. Fast forward to today, my life is so much fuller than in the early days of this injury. I no longer need assistance to run my household, and I'm no longer crippled by terror, anxiety, agoraphobia, and depression. I go about my days with more normality, but I'm still healing after nearly a decade. I still get very symptomatic if I push too much or exert too strenuously. I still struggle to make plans and keep them because the way I feel is so variable. Traveling continues to be mostly inaccessible because of how long stretches in cars leave me internally rattled for hours and sometimes days. The far-reaching consequences of this kind of nervous system injury are hard to comprehend, but they are very real, and the awareness about the dangers of this class of drug remain far from adequate. If this benzo bill were in place years ago, I most certainly would have avoided the immeasurable suffering that my family and I have endured. Thank you very much.
Thank you for your testimony. Do we have any questions from committee members? Okay. Next up, we will hear from Holly Hartman.
Good afternoon, chairs and members of the Joint Committee. Thank you for holding this hearing today. I'm also grateful to all the brave benzodiazepine victims who are here, yet I know only too well that more people who could be here are not. Those who are too ill or disabled, those who are too ashamed, those who have little faith in a system that betrayed them terribly, those who are angry and worried that they would lose their temper here because they feel like victims of a crime, because they knew they deserved to be warned of the risks benzodiazepines pose. I did too. I gave my doctor every opportunity to warn me. I was prescribed Klonopin in the mid-90s for chronic fatigue syndrome. My doctor told me this was a well-researched protocol. I asked if Klonopin was like Valium, telling her that I did not want to take a Valium-like drug. She assured me that Klonopin was safe, telling me that it had been developed to address risks that Valium posed and that it would slow my overactive CFS system down. She further elaborated that people took it for their entire lives, and that as I was living with a decent degree of New York City stress, Klonopin was also great for taking the edge off, her words. I have since wondered if that claim wasn't borrowed from a pharma sales rep, since I have heard the same language used many times over the years to promote the so-called safety of benzodiazepines. Years later, actually the very day I learned by Googling that I could have seizures if I stopped Klonopin abruptly, I found the Ashton Manual, a guide using the research of the late Professor Heather Ashton of Newcastle University. Her tapering guide has been helping people around the world for many years, yet my doctor knew nothing of it. Too few do. After showing the Ashton Manual to my doctor, I did secure her promise to help me taper. As absurd as it seems, Midway through my taper, my doctor's office decided not to refill my prescription. No more refills for you, I was told by my pharmacist in Williamstown, Mass. My doctor's office was ready to cut me off after prescribing Klonopin willy-nilly for over 10 years. Knowing that many times I never even filled the prescription, and knowing that while I was tapering, I was at that point taking less than a quarter of what had been prescribed for me as a daily dose. My story is not uncommon. My pharmacist opened up and told me that benzo prescribing was out of control in our area, that she was seeing many customers struggling with benzodiazepines' adverse effects. They had no idea why they had punishing symptoms like brain zaps, agitation, unexplained panic, severe pain, akathisia, and malfunctioning GI tracts. I asked her if she would consider speaking at one of the earlier hearings held here for benzodiazepine legislation. No way, she said. She would lose her job. What does that tell you? Something's very wrong. This legislation is urgently needed. As citizens, we have a basic right to informed consent. If doctors are not respecting that, then I believe it is your task to legislate it. And one more thing. You know who else is not here? Those whose horrific benzo symptoms drove them to suicide. There are many. Thank you for listening. Please pass this bill.
Thank you. Do we have any questions for Ms. Hartman? Okay, next up we have Ron Afsa. Mr. Afsa, are you with us? How about Stephen Bishop?
Good, Ron. It's Ron Afsa. Can you hear me now?
Yes, sir, please.
Thank you. I have two stories of devastation caused by the promiscuous prescribing of benzo drugs. One is of my own and the other is of my sister, who sadly ended her life as a result. In 2013, I was started on a 0.5 milligram of Ativan, ironically because of an adverse effect called derealization of another drug which was prescribed off-label for chronic fatigue. I was given no warnings or informed consent about benzos and the possible tolerance and dependency which could develop within a short period of time. Unbeknownst to me, a dependency marked by newfound anxiety was developing, and within 2 weeks, my dose was doubled to 1 milligram, then increased to 1.5. When this didn't help, I was switched to Valium. The doctor prescribed 5 milligram tablets and said I could take up to 4 of them a day. Play with it, he said. When that failed, I was switched to Xanax, then back to Ativan. This experimentation went on for about a year and did nothing for the realization, but I had developed anxiety which I had never had. After exhaustive research, I was fortunate enough to meet people who were educated about these drugs and this condition with which I was suffering. I now knew that this was dependency. Had the prescribing doctors educated me before I began these drugs, I certainly wouldn't have gone beyond the 2 to 4 week guideline. At this point, however, it was too late. I realized I had to stop taking these substances. What I didn't realize was how much worse the nightmare was about to get. I was told by a doctor to taper at too fast a rate, which caused further anxiety, resulting in a need to reinstate the drug. This happened twice and led to kindling, and my third and final taper was even more difficult and drawn out. My final taper took 1 year and 4 months. I've been drug-free for over 5 years, but I still suffer from protracted withdrawal symptoms. My sister wasn't as fortunate. She had been on and off benzodiazepine Klonopin for years since college and became sicker and sicker from dependency as the years went by. Her doctors, not considering she may have been ill from the drug, misdiagnosed her with various physical conditions and treated her as such, all while her dose of Klonopin was being increased. Eventually, she was up to 4 milligrams of Klonopin. As she became tolerant to that, the intradose withdrawal became unbearable. At this point, her dose was increased to 6 milligrams and was prescribed the major tranquilizer Zyprexa. Eventually, the withdrawal anxiety came back with a vengeance, and on the morning of October 13th, 2015, she ended her life. The irony here was that she was a drug and alcohol counselor and didn't realize that what she was taking was worse than what her clients were taking. I hope this and other testimonies will prompt you to finally pass this bill. Thank you.
Thank you for your testimony. Any questions from committee members? Okay, next up, Stephen Bishop.
Hi. Thank you, everybody, for listening. I was prescribed a benzodiazepine for minor anxiety from running my food trucks. I took the medication as prescribed, and it worked. Klonopin 3 times a day. I felt good. The anxiety was gone. Over a period of time, years probably, the anxiety was increasing. I began developing other symptoms that I didn't have prior to taking this medication. Severe headaches, worsening anxiety, like my foot's on the gas pedal all the time. I could not control the anxiety. Little did I know I was in tolerance withdrawal. I went to a detox out in California, and they stripped me off this medication within 1 week. I stayed there for 3 months. Everybody that was coming in from alcohol withdrawal or opiate withdrawal, they were all going home in 1 to 3 weeks. I was there for 3 months, and I wasn't feeling better. I was feeling worse. I came home and I met with my doctor, and I had to reinstate to feel better in order to function. My doctor prescribed me 40 milligrams of Valium, and I did a slow taper over a period of 2 years. The last benzo that crossed my lip was on 9/17/17. Today, November 8th, 2021, over 50 months off and still suffering protracted withdrawal symptoms that complicate my life on a daily basis. I still experience a laundry list of symptoms. Severe head pressure, like somebody's got their fist around my brain, or my brain's too big for my skull. Titanitis, stomach issues, exercise intolerance. After every workout, I have a half-an-hour panic attack. Overstimulation of a broken nervous system. Deep bone and muscle aches that no pain reliever takes the pain away. Most days I feel like I have the flu, a heavy dose of it, but I just learned to function ill. If my doctor was knowledgeable about benzodiazepines and I was told of the dangers, I would have looked for another alternative. I never would have taken this drug. The quick fix that I was given was the ultimate nightmare. People are turning to the online support groups because their doctors do not have the knowledge. The doctors are also turning to the online support groups. Due to me educating my own new doctor, his office is no longer prescribing benzodiazepines, as he is trying to educate himself. I know it's too late for me, but if this bill is passed, it will save others from going through this undescribable hell. Thank you to the committee, and thank you for listening to the testimony. And thank you all, Benzo Warriors.
Thank you. Any questions from committee members? Okay, last person to testify on this set of bills, Lauren Omarshan.
Good afternoon, chairs and members of the committee, and greetings to all my fellow warriors. This is actually my 4th time testifying in 5 years. The Reader's Digest version of my story begins in 1982, when I walked into a routine physical with my general practitioner and walked out with a prescription for Xanax. Xanax was my gateway drug to psychosis, hospitalizations, multiple medications, and electroconvulsive therapy. The possibilities of a self-determined life were wiped away with one scribble of a prescription. 19 years after my last inpatient hospitalization, I was taking Ativan as prescribed by my Harvard-affiliated psychiatrist of 23 years. I had no idea of the perilous risks associated with its use. In October 2015, an angel led me to Robert Whitaker's Anatomy of an Epidemic. I was captivated, yet appalled by what I was reading. My story is woven into the stories he chronicles. Finally, decades of physiological complaints validated by everyday people and formal white papers. I started slowly tapering off Ativan in November of the same year. The process was grueling. Headaches, dizziness, nausea, cold sweats, insomnia, night terrors. And, you know, I still have the night terrors almost every night. Goes on and on, alarming weight loss, neuropathy, akathisia, alexithymia, sharp electrical pain. You know, I could go on and on about the symptoms. The point that I want to make in my particular case, I'm 60 years old. For me, this is permanent neurological injury. From the top of my head to the bottom of my feet, my body just doesn't function properly. And because the symptoms are so severe and so unpredictable, I'm unable to work. My story is not unique. There's many others with similar, sometimes even more heartbreaking life stories. And I just would like to end with some reflection that I feel we're at a fork in the road. On one side, it's do the right thing. The other side is just look away. Do the right thing or look the other way. I urge the committee to do the former. Thank you.
Thank you. Any questions from committee members?